Hi, my name is Gentle. I come your way once again with some golden Osce tips regarding this particular station, midstream urinalysis and interpretation. So this is a 12 minutes clinical skill station for adult nursing in the Osce. And previously during our time, I remember it was a 8-minute station where you need to complete whatever you are supposed to do in that 8 minutes. So recently they increased the time to 12 minutes, which is a very good sign to help candidate prepare and execute whatever they are expected to do when it comes to MSU. So today I'm going to share with you some 3 golden tips that is going to help you pass MSU, especially on your first attempt. I believe as an internationally trained nurse, we've been practicing or be conducting this urinalysis back home. But the only difference is the timings, because back home we don't normally stay straight when it comes to the timing of recording the various results. So MSU simply means testing patient midstream urine. So this station, I normally divide it into 3 equal parts. The first part being you giving instruction to the patient to go and collect midstream urine. Everything is in the marking criteria. I'm not going to touch on that much. And then the second part is for you to perform the urinalysis itself. That is the real deal. And then the latter part, that is the third part, is you interpreting the results after the urinalysis. That is also in the marking criteria that you need to know as a potential Osce candidate. So this video is going to give you some 3 golden tips that's going to help you have confidence when it comes to the MSU. One is during the practice, after dipping the test strip for not more than 1 second, you place it on your piece of tissue or piece of gauze or in your tray. At that time, you have to quickly remove your glass. But mind you, before you dip the test strip for not more than 1 second, you need to note the time you are dipping. That is where the calculation of your 30 seconds start. So with MSU, you need to record each parameter, that is the glucose, ketone, specific gravity, and other parameters in a specific time. So you need to record glucose at 30 seconds after dipping the test strip. You need to record ketones at 40 seconds from the points at which you dipped the test strip in the urine. Then specific gravity after 45 seconds. Then blood pH protein nitrate at 60 seconds. And then leukocyte after 120 seconds from the time you dipped the urine test strip in the urine. So in order to get these timings on point, and in order not to confuse yourself or struggling with how to calculate the 30, 40, 45 seconds, 60 and the 120, the first golden advice is to dip the test strip at a point in time that the calculation will be easy for you. So I always advise you dip at either 12 or 6 when it comes to the time on the clock. So they'll give you the stopwatch. Make sure where you are dipping or when you are dipping, the second hand is at on the 12th or at the at the 6th. So when it's dip at the 12th, then the calculation becomes much easier for you, because when you get to 6, then it means it is 30 seconds. When it gets to 8, that is 40 seconds. When the second hand is on 9, that means 45 seconds. Then when it is back to 12, that is your 60 seconds or your 1 minute. Then you need to wait another 60 seconds for it to get back to 12 for you to record the leukocyte. Similarly, when you are dipping the test strip at 6, that means when it gets to 12, 30 seconds has elapsed. When it gets to 2, then 40 seconds has elapsed. On 3 is 45 seconds, and in that format, it will be easier for you to calculate the timings. The second tip is that whilst waiting for the results to come, do not keep your eye on the stopwatch. Your eye should be on the test strip, and then compare the results that is happening on the test strip with the one on the bottle. Many a times candidates make this mistake by keeping an eye on the stopwatch. Yes, your eyes should be here, but not all the time. You should rather focus on the test strip that you have dipped in the urine, reading the results, and then from time to time you keep an eye on the fob watch. So you keeping an eye on the test strip, then from time you look at the time to see whether you are getting closer to the time that you need to verbalize the results. If you keep your eye on the fob watch, then it gets to the 60 seconds. You are now going back to look at the your results and then compare with the bottle before you come and verbalize. By the time you do all these things, the time would have passed the actual time you are supposed to write the results, and that will be a fail. I take it again. When you are waiting for the results, let's say you've dipped the test strip at 12. So you remove your gloves, do a quick hand gel. You are waiting for the results to the second hand of the clock to reach 6 so that you record the first result for glucose. At that 30 seconds or within that 30 seconds, your eye should be on the results or the test strip against your bottle, where you confirm what you need to write. Then from time to time, you bring your eye to the fob watch, send it back to the results. Then keeping the results at the back of your head, you go back to the time and then you verbalize the time for you to record the glucose, and then you record the glucose. So many people also make mistake by verbalizing the results. That is wrong. Just say 30 seconds glucose, then you write the results. 40 seconds ketones, then you write the results. That is the second golden tip. The last one, if you really want to hear the last one, please don't forget to share this video, hit the like button, and also comment whichever areas you are finding it difficult when it comes to the MSU. The last one, which is very important, and that also help you when you read the marking criteria, it says that verbalization of the results is verbalization of the timings is accepted. In order not to run out of time or to pass the time you are supposed to write the results, this is what you need to do. You record glucose at 30 seconds, right? Good. So when the second hand reaches the 27 seconds mark, you start verbalizing 30 seconds glucose, so that by the time your statement 30 second glucose ends, the second hand would have reached on the 6th exactly. That is your 30 seconds, and then you record the results. Same thing when it's getting to 37 seconds, you know that you record ketones at 40 seconds. So at 37 seconds, you start verbalizing ketones 40 seconds. By the time this statement ends, the 3 seconds will have elapsed and it will be on exactly 40 seconds, and you record the results. If you wait until, let's say you are coming to record glucose at 30 seconds, and you wait until the second hand reaches the 6th, then it means by the time you finish your verbalization 30 second glucose, the second hand would have passed the 6th, moving to 35 seconds. And that will eat into the time of the ketones. So by the time you verbalize the ketone, it has already passed the 40 seconds, and then it will go to where? The 45 seconds. In that sense, you've missed the timing. So in order not to miss the timing, start verbalizing them 3 seconds to the actual time. So 3 seconds to 30 seconds, you start saying 30 seconds glucose. 3 seconds to 40 seconds, then you start verbalizing 40 seconds ketones. 3 seconds to 45 seconds, you start verbalizing 45 seconds ketones. I hope these 3 things these 3 tips are going to help you when it comes to the MSU. And one other thing that can help you is to get a bottle of this if you are not confident in that. It's just about 20 pounds on Amazon. Do you understand? Just buy it, get a fruit juice, or you can use your own urine and practice at home and be confident with it. There are some of the scenarios when you meet them, such as the pre or post-op, when you have ectopic pregnancy or hernia repair, you will do that as well. Okay, you do MSU. It is very important. So there are 3 ways to fail MSU, and there are 3 ways to pass MSU. 2 of the ways is easier, and one is the performing the analysis itself. You need to be efficient and confident with that. I hope you put into practice these 3 steps or these 3 tips to help you pass your MSU. My name is Shanto. In any time you need Osce training or advice, you can hit up in our DM and we can take it from there. Thank you very much.